I'd like to quickly run you through tonight's agenda. First, our CEO Adam will give us an overview of Empower Healthcare. Then Mandy will share why community aged care is such a rewarding career path. Kat will then walk us through our graduate program, followed by hearing directly from some of our amazing graduate clinicians, Rashmi, Pascal, Edith, and Paul, as they share their own experiences with us. We'll then cover how to apply along with useful tips before wrapping up with a Q&A session where you'll have the chance to join breakout rooms and ask any questions you might have. So please stay on at the end of the presentation as you'll have the opportunity to ask more questions and join one of our breakout rooms. Over to you, Adam.
Hi, everyone. First of all, can everyone hear me okay? Can I get a thumbs up? Awesome. So we'll just jump onto the next slide. Thanks, Lil. Thank you for that. So I was asked to come along and talk a bit about Empower. What I'm going to do is I'm going to start by taking you on a journey back through time, back to 2015. So back in 2015, Barack Obama was president. The Apple Watch was released. And Donald Trump announced that he was going to run for president, that unknown guy. So it was a long time ago. And back then, myself and a guy called Matthew were really looking at residential aged care. We were looking at what was happening in there with the care that was going on, and in particular, the physio care that was going on. And we looked at it and we said, there's really something wrong. There's something not right about this. And really what it came down to was that physios just didn't want to work in residential aged care. And we were looking at saying that just doesn't make sense. It's such a rewarding place to be. And when we looked at it, what we realized was that they really felt like they were there just to tick a box to get funding. And they kind of were back then. Now things have changed since then, but back then it really did feel like that. So we were looking at it and we said, if we could create a business that is genuinely focused on getting great outcomes for the people that we work with, for the residents in residential aged care at that time, then if we genuinely focus just on those outcomes, then we're going to be able to create a place where physios want to work, where they're doing what they train to do. We're going to get a really great result for the residents, and ultimately we're still going to get that funding that they were looking for back then. But we'd actually do more with that, and really it was that simple. It seems a bit crazy now looking back on it that we started a business on that simple a premise, but we really just wanted to make a difference in that space. And then we start traveling forward in time. Home care packages started being rolled out in a different way in 2017. We took the opportunity to go into that market. We found it was a really great space for our team to be in. Great space for them to be able to explore their skills and deliver a really important service in people's homes. And then a while later, NDIS rolled through and we started looking at NDIS and working out how to deliver services best for people with disabilities and how to make a difference to those people. And the team's grown. You know, we've now got 200 people working for us, which is pretty cool. We cover 4 different states in Australia. And we've gone from strength to strength. But the really important thing that stayed with us is being focused on outcomes. So a few years ago, we looked at our purpose and our vision, and we wanted to try and encapsulate that. So our purpose is to deliver exceptional care that positively impacts people's lives. And I think that reflects what we're all about as a company. And our vision is to be the first choice for care and the best place to work. And that's really important to us. It's really important that we're the first choice for care, clearly, and that mirrors the outcomes that we're trying to achieve. But it's also really important that we're the best place to work. So we work hard on that. We work hard to build a good community within our space, and that stayed central to us throughout our growth and development. So in terms of services, I said we started off doing physio in residential aged care. We've now got quite a wide range of services. So we do everything from nursing through to physio, OT, osteo, dietetics. We've got podiatrists in our team, speech pathologists and massage therapists. So it's a really wide range within the team. And it's great that our team are able to work with each other to really get the best outcomes for clients. So where are we now? So looking back at last year's figures, we delivered over 100,000 hours of care. We had 8,000 clients and worked with 400 organisations. And as I said before, we've got 200 clinicians working for us. So we're really proud of that. And it's great to be in a space which is growing, a space where the difference that we make is recognised. You'll hear a lot about home care packages and NDIS, etc., in the news, and you can really see that there is a focus on that space, and people recognise just how important it is. So it's a great space to be in. In terms of the organisations that we work with, as I said, we've got 400 organisations we work with. It's a really wide range of companies. Now, these people actually refer to us. So they look after people's home care packages or look after their NDIS plans, but they trust us to deliver the services that we do. With the allied health services and nursing services within that space. So I'd say a wide range of companies, everyone from not-for-profits through to for-profit organisations, really well-known names that you'd know, through to small organisations, but they're all really important to us. And it's really great to work with a diverse range of organisations because we work with people of all sorts of backgrounds, languages, all sorts of different things. And it's, as I say, it's a great space to be in. But yeah, so look, that's just a bit about Empower. I don't want to talk for too long. I'm going to hand you over to Mandy, who's going to talk to you about community care. So thanks for listening, and look forward to meeting you all in person at some point soon.
Great, thanks Adam. Can everyone hear me? Thumbs up. Perfect. My name's Mandy. I'm an occupational therapist. I am the we call it DOTS team leader, which is dietitian and OT and speeches here in Victoria. And I thought I'd just start with a little bit about my story and why I am here at Empower and working in the community. My background is mental health. I've worked in both inpatient and community mental health teams across mainly in Sydney, but also over in the UK. But I moved to Melbourne, had a lovely period of long service leave. And then my friend who works for Empower told me about Empower, and it probably wasn't something originally I was thinking about. And I think it's good because it was just such a new environment for me. It was kind of out of my scope. I think I felt like a new grad at some stage. For an occupational therapist, I know we might measure grab rails in the toilet, and this is something that I can't even remember doing before I started. And I'll never forget one of my first visits to a client. The daughter answered the phone. She goes, "Oh, someone really experienced." And I had to have a little internal giggle thinking, "Oh, is that wrinkles that you?" But even though I was so new to the home modifications and some of the things that an OT might come across in this space and in the community, there was such a fabulous community and resources and supports within Empower that helped me. And I know as, a very experienced clinician in my own field, I think that was really important and that was really helpful. It sort of can accelerate your journey and your learnings. And I think that was really great. There's lots of resources. And here I am 3 years later. And for me, just the constant new learnings, enjoying the challenge, being creative, trying to support others, making a difference, improving people's quality of life. And to me, at the end of the day, that's what counts. I guess if you asked an older person, what are their goals? I think they just want to be independent. They want to be as active as they can. They want to be able to stay in their own home if possible with support, And this is where I think we really do make a difference. For me, it's the appreciative smiles, the kind words from our clients, our participants and their families about how we can make a difference and help them to stay at home is really quite rewarding. And I was thinking from all the disciplines, from feeling safer, being able to use the bathroom, complete their personal care, being able to communicate with others, being able to eat a meal and manage eating a meal and have a good diet, to gaining strength and confidence to go out in the community. I think that's really important. And we have a huge role in that. This is how we make a difference. And when I reflect on the background, I think I'm quite lucky coming from mainly community mental health. I do prefer community to hospital. I always have. And this is for me. And I just think in that hospital environment, there's so much pressure for acute bed days to fit something in a little mold and be very quick. It's also time limited, and it limits our opportunities to create those relationships and take a little bit more time to really make a difference. And I guess that's, for me, one of the biggest things about working in the community is really positive. I'm not sure I haven't forgotten anything here. Yeah, very rewarding. And I guess you can see a bit in the word clouds. Working in the community, there's a lot more flexibility than you might see in a hospital or an acute environment. I'll tell you what, my dog absolutely loves that I can work from home while I'm doing reports at my feet, reminding with a little nudge for a cuddle throughout the day. I think that's helped her transition from Sydney to Melbourne. And just creating that work-life balance. It's just nice to be able to get out and drive around and grab a coffee and have a little sit in the park to do your notes. It's just lovely. It's just lovely. It was a really good way to explore Melbourne, I must say. Next slide, please, Lillian. And as I said, one thing that was really helpful for me as a OT that didn't know how to do a grab well was the huge amount of support within the team and all the resources that we have in the programs. We've got things like a buddy system. So when you start, you're linked up with a colleague. So you've got that informal support network for a chat. We do team building here. We work, as much multidisciplinary as we can, which is very important. We have team meetings. So there's lots of information dissemination. So you're on top of what's going on within the company, and just I think that's really important to have that communication and the information. It makes you feel good. There's daily mentoring for some of our teams. There's also Teams channels where you can dive in and ask a question, which I think is really important when you're working in the community in this environment. There's a good lot of support. I know Kat's going to be speaking next, talking a little bit about our new graduate program, but also the induction program. That there's a lot of support, as I mentioned, for new starters here at Empower. We're able to build our competencies. Can't speak, it's the end of the day. Our skill development, building competencies, having people support us and feel more confident with the resources, and reviewing our goals and growth plans. I think that's really important, to be able to have an environment where you can do skill development. Be part of a quality project and some of our programs that we've got here in Empower. I think that's really what makes it a great place to work. And that's my experience of the community. It's an area where, I've worked in the public health system for, if I have to tell you how many years, I'll have to shoot you because it'll give away my age. But I really enjoy working in this environment. And I'd encourage anyone, whether they're a student, a new grad, or an old duck like me, to have a career change and try something new. It's good for your brain, and it's preventative for dementia. Thank you.
Thank you, Mandy. Thank you so much for that. Kat, I'll hand it over to you.
Thank you, Mandy and Lillian. And good evening, everyone. Thanks for joining us tonight. I want to take a few minutes to walk you through what you can expect as a part of Empower Healthcare's graduate program and how our program is designed to help you transition from university into a confident, capable and supportive community clinician. At Empower, our mission is simple. It's to help you reach your full potential. And we do that by giving you structure, guidance, and the right balance of challenge and support from day one. I'd like to start by giving you a quick overview of our graduate program. This is a 12-month program designed to help set you up for success and begin your career. Your caseload will support your individual goals, and you'll have a personalised growth plan to support your professional development every step of the way. The structure of the program is something we're really proud of. You'll begin with a comprehensive induction, followed by clear growth plans that map out your journey. You'll have access to ongoing mentoring and peer learning, and each month you'll be supported through professional development sessions to continue to build your skills and confidence. Now I'll focus a little bit more on our discipline-specific graduate program, which includes DOTS. This is our dietitians, OTs and speech pathology, and POMA. This includes physio, osteo, massage and allied health. Lillian, if you could just change that slide for me. Thank you. Our graduate pathway isn't about just throwing you into a full caseload straight away. It's about progression. We've categorized our program into 3 clear phases that help you learn, grow and continue to develop well beyond your first year. So these 3 phases include 1, learning and onboarding. 2 is growth, which is building your caseload and your scope of practice. And 3 is ongoing professional development. Each phase builds on the one before, so you're never left wondering what's to come or how you'll be supported. Phase 1 is learning and onboarding. The first phase is all about learning and getting you set up for success. You'll begin with our comprehensive induction and orientation, where you'll be introduced to our team, our systems, and the way we work within different funding schemes. You'll also gain an understanding of how each discipline collaborates within these streams, because we're working in a multidisciplinary environment where everyone plays a key part in what we do. In your first week, you'll have dedicated time for shadowing experienced clinicians, and this gives you a real-world feel for what it's like to be an Empower clinician before you start managing your own clients. You'll also have access to a mix of online and face-to-face learning opportunities, covering everything from assessments and progress notes to communication skills, hydrotherapy processes, or equipment prescription, depending on your discipline. And most importantly, you'll never be on your own. So during this phase, you'll have regular mentor check-ins, regular one-on-one catch-ups with your team leader, and the ability to tap into our buddy system and our broader support networks. Phase 2, growth and building your caseload and scope. Once you're feeling a little bit more settled, we'll move into the growth phase. This is where you start to build your own caseload and develop your scope of practice. We keep this gradual and supported. So for example, our physios start with 2 clients per day in week 2 and gradually increase to around 5 or 6 clients per day by the end of week 6. For OT, we will build your caseload over an 8-week period. Throughout this phase, you'll continue with regular professional development sessions, both online and in person, focus on community-based skills and discipline-specific topics. You'll also be allocated a new grad mentor. Together with your team leader, you'll create a growth plan that aligns your professional goals with your day-to-day work. This is your roadmap for development, so you always know what you're working towards and how to get there. And phase 3 is our ongoing professional development. So this final phase isn't really an end point. It's just about what happens once you're established and continue to grow. You'll have access to professional development sessions tailored to both new grads and your specific discipline, case study discussion groups, regular team meetings, and a generous annual PD funding allowance for external courses. and access to study leave. And then the support continues. So even after your graduate program, we transition you slowly out of these supports to where you'll be able to join the regular clinician support models specific to your discipline. This still includes mentoring, report reviews, discipline-specific support and PDs, and ongoing opportunities to build your skills. So just to highlight and recap some of the supports for the new grads, you'll have a comprehensive induction with a gradual increase in key performance indicators so you can take on new challenges at a sustainable pace, regular mentoring and touch points to ensure you always have someone to check in with, a new graduate handbook which will guide you step by step through your first few months, and you'll benefit from both in-person and remote access to mentors, leaders, and peer networks. It's all about building confidence, competence, and resilience, not just getting you through your first year, but also setting you up for strong foundations to build your career on. And why choose Empower? I'm sure you'll hear from our great new grads soon, but you're here, you're not just a number when you're here at Empower, you're a part of a team that invests in you. We offer a structured pathway with personal support and the opportunity to build your skills within the multidisciplinary environment. Our programs are designed to help you succeed while maintaining a healthy work-life balance, and perhaps most importantly, knowing that you've always got great support around you in your mentors, team leaders, peers that will help guide you. I look forward to hearing next from our new grads. Thank you, everyone.
Thank you so much, Kat. Okay, now let's hear from our grads. Paul, are you available? Can you unmute yourself, please? I think you're still on mute, Paul. Sorry. Yeah.
Yes, can you hear me?
Great, I can hear you now. Thank you. So please introduce yourself.
Yep, so I'm Paul. No, 1 second. Sorry.
I'm just going to leave.
Sorry.
Testing. Oh, yeah. So,
Yes.
yeah, my name is Paul. I'm an OT.
Great. And how long have you been at Empower for?
And yeah, I've worked at Empower for approximately 8 months now.
Okay, great. So what attracted you to this graduate program compared to others you considered?
Sorry. Oh, sorry.
That's okay. Take your time.
Yep. Sorry, could you repeat that?
Yeah, sure. So what attracted you to this graduate program compared to others you considered?
Yeah, well, in the interview, actually, I heard that Empower offer a lot of support. They really value that. And I thought that was really important as a new grad, getting that support, a gradual increase in KPIs, and weekly meetings and a buddy system where, you know, you could really learn in a structured way and get that support that you really need. Also, yeah, gradually increasing KPIs and building up the competencies. For example, if you're not when you haven't had any experience, let's say in prescribing wheelchairs, first you get shadowed, and then first you watch the experienced clinician, and then you get shadowed. So they really build you up until you feel confident and you've got those skills. And yeah, I think that was really important to me.
Great. So how has your experience compared to what you expected before starting?
So the expectations were met well and truly through my experience. So there's really been that promised support. Unlike other companies, they really did, you know, follow through with the support and the help. So that mentoring has been really good. There's always someone to ask questions to. And it's similar to what Adam said. I think they've really built a strong, friendly culture here. You know, people are really approachable and you never feel nervous about asking anyone. You can really feel it's a really good team culture, and So that's been really great. Feels really welcoming. And yeah, all the weekly meetings, the new grad sessions has been a really great way to build up my confidence. And also weekly team meetings with the speechies and dietitian has been really good. And also there's been COPE training, so that's training for people with dementia and their carers, and that's been really great too. Yeah, so I've really enjoyed that.
Great. So what would you say to someone that isn't sure about working in community care?
Yeah, I'd say because in my university no one mentioned community care, aged care, but I think it's really great, and I think it's a shame that they don't mention it more. It's a really rewarding career path because you're helping keep people out of aged care, and they really appreciate it. They really value it. And yeah, I'd say go for it, especially if you enjoy equipment, prescription, home modifications, but also capacity building. And so if you like a lot of variety, it's really great and I highly recommend it.
Great. Thank you so much, Paul.
Thank you.
Pascal, it's your turn now.
Hello.
Hello. So Pascal, please introduce yourself.
So, my name is Pascal. I'm a community physiotherapist working full time, and I'm servicing the west and northwest regions of Melbourne.
Great. And how long have you been at Empower for?
So, roughly a year and 8 months. I started in my university placement, and I'm still here now.
That's great. And did you have specific goals or skills you wanted to develop when you first joined?
Yes. So, I think 2 to 3 main things I really wanted to do when I joined. One of them was like communications and interactions between patients, because I think that's like one of the most important things as a physio. The other two, it was more like clinical reasoning and clinical confidence around there. So those are the 3 main things I focused on when I joined.
Great. And how have you found, I guess, those skills? Have they developed, I guess, since you've joined?
Yeah. So basically, I think those 3 things you're pretty much practicing all the time. So it's just more repetitions, and I think that over time it does build up. So yeah.
Great. And obviously, I guess, as a grad, when you join, how would you describe the mentoring and peer support that you've received?
Yeah, so I know it's a little bit different now. So when I joined, we had a 2-year structured plan. So I think it's really, really good. So it's very supportive, and it adapts to how you learn or how I learned. So I think in terms of my case, the first 6 months when I first started, that's when like the very intense mentoring and catching up with either my mentor or a buddy started. So after that, after a certain amount of time, depending on how you like to learn, I think I was more happy to just decrease it to weekly sessions to catch up and just debrief, chat, and catch up about things that kind of, if I had problems or if I needed to talk out some things with either my mentor or another peer. By the end of that, so I usually at the end of the year, the formal mentoring kind of died down. I opted for it. It kind of died down. So then we started doing monthly catch-ups because I felt a bit more confident as I was learning and growing. And till now, we're still doing pretty much monthly catch-ups where with a bunch of new grads, we talk with each other, see what we need help with, if we need to discuss anything, or just catch up a little bit. Yeah, and all these things, they've been booked into your schedule, so it isn't something that's off schedule or anything. So it's really good. Peer support in terms, I know because we're on the road a lot, it's still pretty good. We do monthly team meetings, catching up, and then every once in a while we do face-to-face meetings as well. So yeah, I think the support is very good.
That's great to hear. And finally, what would you say to someone that isn't sure about working in community aged care?
Yeah, so I think I was on the same fence too. I was when I first came out of university, community care wasn't even on my radar as well. But until placement happened and going through everything, I really enjoyed it. So I was still kind of on the fence about that as well. But I think I kind of dug down and just say, let's give it a go. And then I think that's the what I recommend. If you're on the fence, just give it a go. You're still getting something out of it if you don't like it. But yeah, I think it's one of those really rewarding experiences, big lessons that you learn, especially personally and professionally. So yeah.
Great. Thank you so much for your time, Pascal.
No, that's right, Lily.
Edith, are you available to join?
Yeah, I'm here.
Great. Edith, can you please introduce yourself?
So my name is Edith Tang, and I'm a graduate OT here at Empower, and I have been joining the company for almost 1 year now.
Oh, great. So why did you decide to join a community role rather than hospital or private practice?
Sorry, I couldn't quite catch that. Could you please repeat?
Yeah, sure. Why did you decide to join a
Yeah.
community role rather than hospital or private practice?
Yeah, so I'll be honest, I'm not a morning person. So I feel that working in hospital is a bit too early for me. And working in community allows me to manage my own schedule. And I may be able to choose 1 day per week for example, working from home, which gives me more time to focus on reports without feeling rushed to set off and go to see clients. So I prefer this kind of working mode.
Great. I don't blame you, Edith. I'm not a morning person either. So what has been the most valuable part of the program for you so far?
Yeah, I would say I really like the mentoring support, the daily mentoring session. As a new grad, I was a bit nervous about working in a community OT, and I heard it can be quite a common problem that people just start their solo initial assessment without getting support. But I can jump into daily mentoring session with different senior OTs. And different OTs have slightly different expertise and perspective. So you can get to it's like learning from different teachers. And you can absorb the strength of different OTs and incorporate them into your strength.
Great.
Yeah. I can also reach out to, for example, I can reach out to team leader if I have doubts. And I think the culture is really supportive. They're really supportive and responsive when I need more advice and support.
That's good to hear. And finally, what would you say to someone that isn't sure about working in community aged care?
Yeah, so I would say there are two important things working in community aged care. The first one is you have to be very organized and structured because although I just said flexibility, I think flexibility is important when you are conducting the sessions, just like you're working in other settings, because the clients are different and things don't always go as you planned. But you also have to be organized, and because you are managing your own schedule and caseload, you have to arrange the trials by yourself. You book the showroom and do the follow-up visits. You will also have to hone your communication skills by talking to different stakeholders, communicating with the client's family, which sometimes they can be a bit anxious and sometimes they may not completely understand the guidelines, etc. So you have to be flexible when you're communicating with them, but be organized and stay within your scope and be organized in how to manage your schedule.
Great. Thank you so much for that.
Yeah, I think these are transferable in other settings.
Thank you so much for that, Edith.
Thank you.
And finally, Rashmi, please introduce yourself, Rashmi.
Hey guys, my name's Rashmi. I'm a physio working across home care and also the residential aged care space. Also doing half day of marketing as well with Nicole, where I help out with some content creation.
And how long have you been at Empower for?
So yeah, I joined as part of the new grad program back in 2022. So yeah, I guess this will be my 4th year out, which is pretty crazy. But yeah.
So I know it was a while ago, but what attracted you to Empower over other companies at the time? And, how did our values and culture influence that decision?
Yeah, for sure. So I was really lucky, like Pascal, that I got to have a placement with Empower. So I was able to see what physio looks like in the community space, but also residential aged care setting as well. And I guess at that point, I was sort of at a crossroads of coming up to doing, 4 years of a course and not really enjoying much of the acute settings that I did have. So I was really, really, really grateful to get exposure of what physio can look like in this field. I guess actually being on the road and seeing the clinicians work together as a team, getting the best outcomes for their residents and clients, being able to see, someone that's had a hip fracture that's not walking, team getting together using, best evidence guidelines and altering treatments as they need to get them walking again. I guess it's one thing to sort of see the initial part of it in a hospital, but what actually happens after in terms of that rehab process was just amazing to see. And then even on the road in the community setting, seeing not only beyond the treatments, how you as a clinician can make a difference to a lot of these people, whether it's mentally or socially. I know a lot of my clients sometimes, just for a chat, and you got to sort of, interlace the treatments in there as well. But yeah, it was just amazing to see the values, I guess, seeing them actually in real life as well. And yeah, I guess seeing all of that made me want to be part of that culture at Empower, where I would know that I would get that support from the other clinicians, but also be able to provide the best care, whether it's working with them or just getting that guidance from them, really.
Right. And I know you've worked across a few different settings. So
Yes.
tell us a bit more about your journey.
So yeah, in the community setting, we've obviously worked across NDIS clients and also home care package clients as well. I've done a bit of hydro with some of those clients, depending that they've met the criteria for that. Part of the community setting, we give out education sometimes, depending on some of the stakeholders in terms of the companies or whether it's the clients, teaching them, I guess, what home care packages can look like, or falls prevention education, I guess like the benefits of physical exercise, getting them to engage in that sense as well. I've been on the other end of it now that I'm a mentor for one of the new grads this year. So we've transitioned from having those weekly meetings to fortnightly now. That is on the second half of the year. And similar to Pascal, he sort of felt that he was able to be at a point that he doesn't need that sort of weekly check-ins as well. In the residential space, so worked across multiple sites now over these 4 years, and at a point now that I'm a team leader, where we're sort of a point of communication for the regional managers across those main 2 sites. Content creation, that's also been really fun as well, for that half day, kind of switching off the brain off like the physio side of things and being able to sort of creatively input and socially some of those trends and whatever it is to with clients and with clinicians as well. And I guess maybe a bit more behind the scenes, working with a group project that we've been trying to introduce a global outcome measure to the company. So it's been, I guess, rewarding to see what happens behind the scenes of these frameworks that we're trying to introduce to get the best outcomes for our clients as well. So yeah, a little bit of random things.
Bit of everything. That's that sounds amazing.
Yeah.
And what would you say to someone that isn't sure about working in community?
Yeah, I'd say it's really rewarding. I think we get the privilege of being able to go to these clients' houses, and that means, seeing them in their own space of, whether it's their partners of like 65 years plus, or there's their animals and their kids and grandkids, and you just get to work across, different spaces like that, and you get to build not only like the treatment sides of things, but even just socially and some of the things you learn about these people. It's just, yeah, blows my mind every day. And some of these clients I've been seeing for years and, very easily become an extension of their families to a degree. They're always trying to give you the biscuits and teas and, you have to call them nonna, nonno, and all things like that out of respect. But yeah, I'd say obviously take the time to figure out what you guys all enjoyed from your placements or things like that. For me, it meant, I think, having that social connection and ability to have the time to do clinical and having the time without having like a discharge sort of, what do you call it, time pressure. Like I enjoyed that a lot. So yeah, it could be something you guys really identify with if that's something that screams out to you.
Thank you, Rashmi. And thank you to all our grads for sharing their experiences. It's it's really wonderful to hear. So we will move on to I guess how to apply. So if anyone on tonight is interested in applying, simply head to our careers page and click on current opportunities. And you'll be able to look and see, what roles we've got at the moment. If you have any specific questions, you can always email us. Our email's on the screen there, and we'll send some information after today's session. There's also a phone number. Feel free to call, and someone in the recruitment team will be able to help you with any questions you may have. It's a very similar process of applying for our graduate program as well. So again, just head to our careers page, have a look at what grad positions we've got.
Then
Ooh,
they were going
sorry.
for different professions, like
Sorry. Yes, so just head to our careers page and have a look at opportunities. If there's something, if the opportunity that you're looking for is not on our careers page, feel free to email us. We're constantly growing and always looking for people. So even if we didn't have an opportunity right now, we'll keep you in mind for any future or upcoming roles. Please make sure that you attach your CV along with a cover letter when applying. We will then reach out to you if you're successful. We'll have a bit of a chat and we'll organize individual interviews. And then there's our graduate induction day. So if you're one of the lucky ones to join us as a grad, we do aim to have one graduate induction day where all our grads join on that day and they get to meet each other and they get to start the journey together. However, we understand that it's not always that simple, and sometimes people might get their registrations like mid-year or even towards the end of the year. If that's the case and you still wish to start earlier, that's also okay. We can usually accommodate that, and then we would get you just to join the rest of the grads on the graduate induction day. So our start dates are pretty flexible. Some tips, I guess, on application. So with your resume, I guess it's just keeping it simple, removing any unnecessary information. You don't need to, put any of your photo or age or relationship status on there. Anything that, is not relevant to the role, there is no need to include on there. Again, simplicity is key. So choose a layout that makes, that has clear headings and plenty of white space. So again, focusing on the formatting. I say white space because that does help recruiters scan through your resumes and, look for the information that, or locate the information that they're looking for. So just make it, as clear, as simple as possible. Always spell check. It does leave, I guess, a good first impression if your resume reads well. And yeah, I guess just make sure to include any online courses you've completed, any clinical development workshops, or any professional development modules that you've completed as well. So anything that you think, would make your application stand out. In terms of interview tips, so make sure that you research the company before the interview. The more you know about the company, the better placed you'll be to give relevant answers to the interviewer's questions. it also shows that, you're keen, you're interested in the role, and it just, it's a good impression to leave. Prepare for behavioral interview questions. So, make sure, think of examples before the interview. So prepare answers using the STAR method, and that's looking at situation, task, action, and result. So think about different experiences that you've had. Think about, maybe something challenging, maybe some projects you've worked on, any successes you've had, any lessons you've learned, and just have those examples prepared before the interview. Come prepared with questions. It's always, this is the interview is also an opportunity for you to interview us. So, come prepared with as many questions as you want. You can never ask enough questions, I guess, at interview stage, and it is a big decision to make. So you want to make sure that you are making the right choice. Honesty is the best policy. So if you have other job offers, just let us know, and also be transparent with other companies. The reason we ask this is just so we can, if you do have a number of job offers and you need to make a decision soon, then we can help expedite that interview process and help you get to the point where you've got all the options in front of you and you can make that decision comfortably. So just let us know where you're at. And finally, the hiring manager would usually be the person who will be your mentor or manager, so the person that's conducting the interview. But if not, it's okay to ask to meet some of the team members. We also offer shadowing sessions as well. So with our roles, we say, you know what, if you're not sure if community is right for you or even residential aged care, and you just want to give it a try, we do offer shadowing opportunities where you can come in for a day or half a day and shadow a team member. And yeah, I guess find out yourself if this is the right role for you. So finally, before we go into our question time and breakout rooms, I just want to say thank you all so much for joining us tonight. We hope that you've walked away with a clearer picture of what community health is really about and the opportunities it can open up. A big thank you to our Empower team for sharing their stories and insights. So if you would like to continue the conversation and ask more questions, please feel free to stay back so you